Hi, my name is Elena Henson, and we're going to be talking about COPD. So, from our learning content regarding COPD, we're going to learn to identify COPD, supportive prevention, maintenance therapy, and then rehab education and self management. And then each one of those is broken down into several key points. So, first, we will be learning identifying COPD. That would include what is COPD and symptoms, known causes of COPD, how to diagnose COPD, and classifications of COPD. Then we will go into supportive prevention, which will include the key points of prevention, maintenance for COPD, and exacerbation prevention. And then maintenance therapy, and those will be broken down into drug therapy for COPD, initial pharmacological treatment, guide on drug categories needed by COPD patients, progressive needs for adding meds, factors of initiating inhaled corticosteroids. And then lastly, we will talk about rehab, education, self management, which will include pulmonary rehab, symptom control, oxygen therapy, and ventilation support for patients who do need ventilation support, and then surgical intervention. What is COPD and symptoms? COPD stands for chronic obstructive pulmonary disease. It's a condition that is caused by damage to the airways and or other parts of the lungs. Symptoms for COPD include trouble catching your breath, especially during physical activity, wheezing or whistling sounds when breathing, ongoing cough that may bring up a lot of mucus. Mucus may be clear, white, or yellow, greenish in color. It would tend to be more yellow greenish when there is possibly like a lung infection like pneumonia. Lack of energy or feeling very tired, frequent lung infections, losing weight without meaning to. This may happen as a condition progresses, swelling in the feet and ankles. The losing weight has a lot to do with the fact that COPD patients burn more calories. Their body just tends to burn through a lot of calories just because they're constantly trying to breathe. Their respiratory muscles are working overtime to try to keep breathing, making those calories burn a lot quicker. COPD is made up by 5 obstructive diseases, and they include cystic fibrosis, bronchiectasis, asthma, chronic bronchitis, and emphysema. And they are known as CBAPEs. To have a COPD diagnosis, you have to at least have of these, um, two of these chronic obstructive disorders. So most of the time, you see a lot of chronic bronchitis and emphysema paired together. Asthma is also in there, just because a lot of asthma patients having already damaged airways and more troubles with their asthma can lead to COPD. Okay, COPD causes and classification. So, causes are an exposure for lung irritants like tobacco smoke or chemicals can damage your lungs and airways. This long term exposure can cause COPD, which include the 5 obstructive diseases or CBAPEs. Most common ones are chronic bronchitis and emphysema. These are the most ones that a lot of people see. And then non smokers can also develop COPD. And then those risk factors include for the people who are non smokers a history of child respiratory infection, smoke exposure from coal or wood burning stoves, exposure to secondhand smoke, people with a history of asthma, people with underdeveloped lungs, and people older than 40 since lung function declines with age. For non-smokers, it's just mainly like a lot of like these lung infections, underdeveloped, and just exposure to a lot of these chemicals already damages their lungs at such an early age that as their life progresses, it can lead to COPD. Classifications for COPD is an obstructive lung disease, meaning that there is chronic airway inflammation and narrowing, making it difficult to exhale fully, causing air to become trapped in the lungs. It is categorized in 4 stages of severity, which are mild, moderate, severe, and then very severe. The level of severity is based on lung function, and FEV1, and symptoms, guiding treatment with symptoms worsening from occasional breathlessness, which is a mild case, to disabling shortness of breath, even at rest, which is a very severe case. So we will go to the next slide. How to diagnose COPD. The tests and assessments for diagnosis include spirometry, most common test that can be diagnosed by measuring the amount/speed of the air you blow out. It assesses lung function. That is how you can get your FEV1. It measures just how much air you can exhale forcefully in 1 minute. Your alpha 1 test diagnose COPD due to patients with COPD lacking that alpha 1 antitrypsin protein. Chest x rays do not fully diagnose COPD, but it does rule out anything like a pneumonia, and just like any other kind of lung condition, something like that. CTs may show the type of disease of COPD, like emphysema or chronic bronchitis, the progression, and the severity. Oximetry or an ABG, they measure the O2 and CO2 levels in the blood. Lung volume test measures lung volumes and oxygen that remains in the lungs after exhaling. As far as lung volumes tests, those include and are also known as PFT, which is pulmonary function test. It just kind of assesses the function of your lungs. And those include spirometry as well, and getting your FEV1. It also measures your FVC, your forced vital capacity. And with those two, between the FEV1 and the FVC, we can get the FV1 FVC ratio. If it's under 70%, that can confirm a COPD diagnosis. Also in that category, there is a plethysmography, also known as a body box. And that one measures your total lung capacity and your reserve volume. A diffusion capacity test shows how O2 enters the bloodstream. A lot of patients with emphysema cannot diffuse easier, so that's how a lot of emphysema patients get diagnosed. And then there is an exercise test, which is a 6-minute walk test. It evaluates shortness of breath during exercise. Key indicators and factors for diagnosis include dyspnea, chronic cough, productive or non-productive, low exercise capacity, audible wheezes, frequent longer-lasting bronchial infections. COPD patients tend to have obviously weakened immune systems, weakened lungs, damaged lungs, so therefore they are prone to more lung infections and constant. Classification of airflow limitations, severity in COPD, which is also known as your gold standard for COPD, to be categorized as a gold 1, which is a mild. Your FEV1 has to be greater or equal to 80% of predicted. Your gold 2 has to be considered moderate, has to be greater than or equal to 50, but under 80% predicted to be a moderate COPD. For gold 3, which is severe, it has to be greater than or equal to your 30%, but under 50% predicted. And your gold 4, which is your very severe, your FEV1 is under 30% as predicted.